Order of the meeting of the County Health and Human Services Board. Roll call
Dale Schluter,
here.
Marshall Savitsky,
Here.
Kay Wilson, here, Michael Maestri,
Yeah.
Chris Rusk. I do not hear Chris. Lorraine Gouget, here, Dawn Pettit. I do not see her online. Carol Pearson, yeah, Sabrina Dunlap. Yep, you have a quorum.
Thank you.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Meeting agenda. Changes. Okay, moving right along. Public comment.
Should I certify the meeting?
I did, yeah.
The meeting was, has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Thank you for catching that. Now on the meeting agenda, any changes? Okay, we can move on then. Public comments.
I did not see any hands up.
Okay. Election for new vice chair. Discussion and possible action.
Yes, and I will conduct that election, and you're going to use your clickers. And when I open the vote, you're going to choose either green for yes vote or red for no vote. Let me get to the software here. So I will now open the floor for nominations for the position of vice chair. If necessary, we won't have to worry about electing a chair because we didn't have a change there. But a person receiving a majority of votes of members entitled to a seat shall be declared elected. The vote shall take place by electronic voting equipment. If no majority is reached, balloting shall continue, including all nominees, until a majority is reached. So at this time, I will open the floor for nominations for the position of chair. Do I have any nominations?
I nominate Kay.
Oh. By Marshall. Do I hear any further nominations? Any further nominations?
This is for chairman.
A vice chair. Vice chair.
Well, I'll nominate you.
Okay, we have a nomination by Kay for Marshall. Any further nominations? Last call for nominations. Okay, so we will I suppose, Andy, we just go by majority then for the first vote.
Yeah.
Okay, so I have the voting equipment open for the nomination for Kay Wilson as vice chair.
Oh. You should
How would you like us to do that? Because it's changed a bit with two nominations.
yeah, hang on just a second.
Okay, he's gonna check. We usually.
We don't have I don't have policies to really memorize.
Yeah, I agree. Well, I think, don't we do it by then closed vote? It's paper. I have paper. We can do that.
I'll double check that.
Yes, thank you. I think that's the case. We won't. Okay, so you will cast one vote for.
I need to get by that.
Oh, are you moving?
I am, sorry.
Okay, and then with Lorraine, I'll get Marshall. There. Thank you.
Thank you.
You're welcome.
Do they need clickers for anything else?
Not at this point in time. I don't believe we will be able to put two nominations. sold, you'll cast your vote and I'll collect.
Tell me what you're doing again now.
For voting on a vice chair between Kay and Marshall.
Okay, so write down one name.
One name.
Came only 3 letters. Easier to spell.
That's okay. Yeah. I can get my steps in. Okay, we have a vote of 4 votes for Kay and 2 for Marshall.
Congrats.
Welcome to your first committee meeting. Talk about first meeting. They're called a short straw. Let me get out of this then, since we won't need it. It takes a long time.
Did they all vote?
Now let me close it.
Did those guys all vote too or no?
Oh,
Oh, yeah.
you're right, because we forgot that Marshall was online. Marshall is, or Michael is the only one to vote online. Now, that's gonna be more difficult because in the past, they had to cast their vote early by email, so that was anonymous. It's not gonna be able to happen. Many counties, Andy, do not allow a vote for this via Zoom.
We don't have any
We don't have anything in our policy,
policies.
but we should get something in there.
Let's see if, I think Michael wants to say something.
Okay,
For the time being, I'd like to give 1 vote to each of them.
it would not change the vote either way. It would not change the results. So add one more thing to the personnel or the
Yeah.
policy manual. Always get something new.
Congratulations.
Yeah, I just remember that.
Thank you. Don't ever be sick.
Why don't we trade places now and have some,
No, thank you. Yeah, let me see how it goes.
Okay. Meetings from last month's meeting. Approval of last month's minutes.
I'll make a motion to approve last month's minutes.
Second.
We have a motion and a second. All in favor?
Aye.
Opposed? Nobody? Okay. Moving on to committee reports. What? You can go first, Julie.
All right, I'm gonna go through this now, try to read my writing says real quick. But I had an update from our clinic, see what's happening with COVID as we're still coming out of the pandemic. And here's what I had received. The LCO Health Center reported 3 employee positive cases of COVID-19 so far in the month of May with cold-like symptoms. In April, there were 0 positive cases for COVID and of the flu and 0 cases of RSV. However, we have 3 cases as of now that are positive COVID-19 and they're closely related. They kind of infected each other. 1 employee will return to work tomorrow and 2 will be returning on Thursday. So that's what's happening that we know of. But not all of them are coming to the clinic anymore with those symptoms. They are staying home, taking care of themselves. We really don't know, but this is what we know as of right now. The tribe approved moving forward now with the construction project of our new clinic. So that will be starting now. And the groundbreaking will be in June. So we're looking at 2025, having a new clinic and providing more care for our people and being able to build from there what we can for services. Our new MAP program that we moved is providing more care also that we moved from Bishiki to the clinic, the LC Health Clinic. And more and more people are getting used to the transition now, and we're providing more holistic care. So all the services are there for them that they need as they address their addictions. And within our clinic too, we're also adding onto our dental department. We have that need out there for dental care. And we cannot provide to meet that need, so we're adding on to what we have right now, so we can have one more dentist and 2 more operatives. Help us to reach more of our patients that need that.
How many dentists do you have right now?
I think there's 2 that we're gonna add on. If I'm not mistaken. We also we got different things that are happening right now. We are building with infrastructure, the K&B loop is called for our water system. And so we're on K, we're going around B to come around, so that as we develop more, like our health center, we got our apartment building. We have our casino has needs now for more of that with the structure there and future development. And so that K&B loop, we are breaking ground tomorrow. So that construction will be started. And I'm not sure how long, I'm not sure how long that's going to take. However, we are also looking at, we're pursuing building a supportive housing. So we are trying to get that structure. We're finalizing now the location, and then we're going to move forward with that. And that will house 20 people who need that care. And that will cover those who are, have a disability or recovery or mental health, those kinds of needs. There will be 20 units there. The apartment building should be done in the summer, beginning of fall, around that time. So then we will be able to have our workforce, the sporting partners there, move into those apartments. So it's moving along. We had a benefit fair recently for our community, and it was well attended. I thought it was well attended. And those who are homeless and those who needed more help, it helped them connect with more of the support that is needed. And it was for the whole community. So I bet there was like 90 to 100 people. So around that. So it was good to want to continue that and to be able, so they know what's there for them now, and to connect them with what they need. So that went very well. Our elder center is going to be breaking ground now in July. So the new elder center will be started that time, and completion date of February next year. And with that program, we are still addressing the food insecurity. So they had 200 boxes of Badger boxes that were distributed to the community. And May 10th, tomorrow, is the last distribution unless more funding comes through. So tomorrow will be the last time. And they served over 200 meals to the elders, and we're trying to get more of our elders to come into the center. Right now, today's training. So we're putting on a pandemic, socialize more, use each other more, and support each other in that setting. So we're trying to get them to come to the center. So that'll help. We have a event hosting a Medicare outreach event in August for the community, August 30th at the Seven Winds Casino Convention Center. And we invite anybody who would like to come and bring a booth to join that event, if they would like to share information, anybody in our community, and to have that for our community members. And Allison Cuddy from the Elder Center is a contact person, but again, that's August 30th. And then the former Governor Martin Schreiber is going to be one of the presenters at that event. And I think that covers the things I wanted to share.
Can I ask a question?
Yeah.
On the water project K to B, will that require an additional well being drilled? And is that going to be a high capacity well then?
I think it's connecting.
Well, you already have.
Yeah. It's connecting and it's going to be able to provide more. So I'm not sure about the well, how it all breaks down, because I'm not an engineer, but it is connecting. And then there's gonna be stuff for future development. If there's anything that goes within that area.
Be interesting to know if you're going to be drilling more wells for the capacity. It just,
I think I don't think they're gonna be drilling more wells, as far as I know.
Yeah.
Because we have the water tower that they're gonna be connecting to in the Wayden. And
but you think of
over by,
the apartment and the new clinic, and that's a lot.
yeah, there's,
It's a lot.
then they have ways of connecting, so. I really can't say exactly.
Okay, I was just curious.
Yeah, but I'll ask. Sure, because I'm not, but I know they are connecting with what we do have.
Mhm.
Thank you. Senior Center report,
Joey said the only thing that's changed is they heard from the state that they think they'll finally get some of their funding coming through in June.
was supposed to be here last month.
Yeah.
I just can share too that as part of our, with the senior center this year, as part of the budget process, we agreed to give them some in-kind help through maintenance and IT. And so IT has given them some help, and maintenance has been over there recently working on a sink project, counter project, and then some snow removal in the winter time. And minimal hours, but we have been
Well, it's very much
doing
appreciated.
some work with them.
Was somebody online trying to talk?
Nope, I think you said a new person entered the room and we muted them.
Okay. Administration,
Do you have anything you want to start with, or do you want me to?
You can start when I will
Fill in?
follow up.
Perfect.
But
So one thing I just wanted to do is give you an update on where we're at in the department with staffing. I think I've shared that it's been a little difficult here the last few months, particularly in our CPS area. So what I've thrown up on the screen here is kind of a visual aid showing the org chart. The names aren't so important, but on the far left side is our Children, Youth, and Family Services division. So the director position, division head, as you would call it, is vacant. Carla Kay we had moved her into just a caseworker, social work lead position, and brought in Season Westfall to be on a contract with us to lead that division a couple months ago. Season's done that work in Burnett County and Wapaka, and works for the Advocacy Center on the east side of the state. So we have her under contract for 20 hours a month doing supervision remotely, which has been a big help of her experience and she screens the cases, assigns the cases, and kind of tracks everything for us. Carla is the lead worker, has given us notice of her retirement. Her last day is on Thursday, so that position's open. So the pink boxes on this org chart are the ones we're recruiting for. So Carla's done. We did have a new hire start yesterday. Tyson Marlowe is our new caseworker, social caseworker. Oh, sure. Sorry.
there.
It's the state of Wisconsin has a little bit different training program now than they had in past years. There's always been a intake or training process for CPS workers. One of the differences this year under the program is they can't take on a caseload right away. They have to go through the training, and then actually they can build up to half of a full caseload until they complete all the training program. So we have her started going through. She started on the training. We also have an agreement with a couple other counties that she'll be shadowing for the first month to really learn the ins and outs of being a social worker or a caseworker. With the vacancies we have, I mean, we had already planned to do that, but really we don't have any internal capacity right now to do our own training. So we're appreciative of those counties helping us out. And we are looking, we've had some conversations with retired social workers. We don't have any commitments yet, but of actually hiring somebody to come in and be a mentor and spend some time in-house working with our new hires. Because one of the other pink boxes there, we had two vacant caseworker positions. We did do interviews last Friday, and made an offer to one of them, and that was accepted verbally this afternoon. So we'll be filling one of those. That person's coming in with very limited experience as well. So we'll need to get them trained, which is going to take months before they'll get up to being having a full caseload. So essentially, we have 3 positions open in CPS that we're recruiting for: the director position, the lead worker, and then a caseworker / social worker. Sarah Inchauskas is our youth justice lead worker. She's really taken on a lot of work. She's got a full caseload with youth justice, but right now is really our only boots on the ground. So if Marshall needs something in the middle of the night, that's most likely the person who will respond for any type of child abuse situation, child neglect. And then we do have, outside of that though, we do have things covered. We have 4 LTE employees. 2 of them are CPS managers from adjacent counties that come and do case management on nights and weekends. Another one of those is from a little bit further away. And then another one is a retired police officer that has a background in child neglect investigations. So they kind of cover what we're not covering with full-time employees. And then in addition to that, we probably have another 5 or 6 people from other agencies in the region that help us with on-call, like phone calls. Again, I'll use Marshall as doing his police work. We have people that they can call in the middle of the night first to get advisement on how to handle a case. Some of those are from Lincoln and Wood counties. If there are kinship or foster care issues, we also have people from our other counties available as a resource to address things on a phone call basis. So not a good situation, but we're really hopeful that in the long run, this will be for the better of the department and the county, and we'll get it rebuilt and get it fully staffed and move on. Other staffing, adult long-term care, ADRC, Sarah Sebecki, family had a reason to relocate from the area. So we are recruiting for her position. She's staying on a remote basis until such time as we can fill that position. And then the other one I wanted to highlight is in the blue. So with Julia Lyons becoming our Health and Human Services Director, she can't take dual roles of also being the Public Health Officer. So on the interim basis, when that move was official last week, Julie McCallum, who's one of our public health nurses, was named, I appointed her as the interim Public Health Officer. She's back, she's here. And we are putting her forward to the board for appointment as the permanent public health officer. So if you're not aware, we have a level 3 public health agency. 2? Okay. 2. All right. Oh, it said 3. Well, anyway, wherever level you are, there's minimum requirements of who can be the public health officer. Experience, but primarily the main thing is it has to be a master's level, someone with a master's in public health or a related field. We're very fortunate actually that we had Julie here, and Julie essentially waiting in the wings. Julie has 25 years of nursing background, 20 plus in the public health area. She has a master's of public health.
Which allows us to be a level 3 if we want to be.
That's where I got it.
That's where you got it.
Oh, okay. Well, looking ahead, we have opportunity. I don't know what else comes with moving from 2 to 3, but so we're out kicking our coverage right now with her background.
Exactly.
So it's good to pull from within. Presuming that goes through the appointment process, then we'll be recruiting for a public health nurse to fill that position. I think I covered all the thing I could cover.
I think you covered all of the major changes. Yeah.
Can I just want to throw in there real quick. We have graduates now coming out of the university. Just keep in close contact with them to recruit who we can, who are now coming up and we're getting those degrees, and that can help us fill some of the needs that we have.
Thanks for prompting me on that, because we did make contact out there. One of the other things that's happened too is, and I don't know how far back you have to go, but generally social workers is what you wanted in these positions, which means you have to have a 4-year qualifying degree to become a social worker. Those requirements have I don't want to say they've come down, but they've changed that outlook. So it's gone from being social workers to being maybe a social service worker with a 4-year degree in a not social work field. And actually now we can hire without a degree or a 2-year degree or so we've opened up our qualifications for those positions.
Oh, that's good to know.
So
Very
we'll
good.
Because you have like a human services degree.
Yeah, we got human services, and I know they're, AODA, you know, there's different departments there, but, that's good to know.
Mhm. Yep, so we had, we talked to the state about that and got the opinion of our corp counsel. Really, we're looking at, qualifications. Somebody could have a lot of work experience, but not maybe the right degree. So we can weigh both sides of that when making a hire.
Good to know.
together a good orientation training plan to make sure that we validate that they have everything in place.
Yeah.
I think really the only other updates is last Monday was my official start date. So, and last week I actually went to conference for the week, which was kind of hard to do on my first week, but really, really good connections with other human services directors, good connections with the departments that are health and human services as well. So I think it was well worth it. Some good best practices, a lot of discussions on CPS. So I've got a lot of connections that I can reach out to as we build that program. So priorities right now, I haven't been able to have one-on-ones with all of the supervisors yet. So kind of moving into that mode. Working very closely with Susan, who is our interim director for CPS, and be working on Carla's transition plan, meeting with Tibissum and Susan and Carla tomorrow to make sure that we have a good transition plan as Carla retires. And then just trying to make sure we get Julie onboarded so that I can transition some of the health officer work off and over to Julie. So those are kind of the priorities at the moment.
So did you start officially then? Did you officially start?
As interim, I'm currently.
Yeah. When I came off, we had to have an interim anyway. So that's how that worked.
Yeah.
I know, we're very, very, very lucky.
Yeah.
To be able to.
Thank you. Steve? I don't want to say lower the standards, but change the standards. Was that because of a shortage, and do they need to get more people in the pipeline?
I can only say, as my opinion, I believe that's part of the problem is that, I mean, I've been following up with all the other counties that are helping us, and we had some good conversations, and we're getting help because a lot of the other counties have been in the position we're in. So we've actually had a little bit of a roadmap to follow with Burnett County and Lincoln County. They've all had struggles in the CPS area. So I think the state, I'm not even going to say they've lowered the standards. They've reinterpreted the standards they already had. And they want, they kind of have some, covering their own rear end language about having us talk to our corp counsel. The other thing they've done though, is maybe they've taken a different viewpoint on what standards they require. They've also increased their training program that the employees have to go through to become take on a full caseload. So, I mean, there's actually a training classes or.
Yeah. I think in the long run, it's actually going to be better and it's going to be healthier for our own staff. We'll hopefully have better staff retention as we move forward. So
that's a primary goal of ours now, is to do a good job, or I would say better job of when we bring new employees in, we're looking at retaining them. So giving them good training and a good experience. I think everybody realizes it's not great work. It's hard work. It's uncomfortable situations. It's difficult. You've been out there, So you kind of have to balance that out with making sure we give them the support and the training so they can be successful at it.
I think that's great. Like I said, I didn't want to use the term lowering standards, but I just wanted to know what was going on. Because I do remember years back, but it seemed like every meeting that we attended, Health and Human Services Board meeting, so-and-so has to go from bachelor's to masters. And this position has to go to a master's, this position has to go to a master's.
And there's still some statute in other areas, but this one we looked at thoroughly, so.
Well, I'm glad to see the state is moving in the right direction.
Yeah.
Okay, any questions, comments, concerns? Economic support?
About adult monitoring care.
Yeah. Yeah, so,
Did jump ahead on.
Okay, please, go ahead.
So, Sarah has given us a report, one of the good things is we were, in need of the information and assistance position that has been filled. It's a joint position with Iron County. And that position just started last week. I was gone, so I haven't had a chance to meet him. So I'll be getting over there this week. So that's positive. The other thing with Sarah, working remotely, I was able to meet with all of the staff prior to her leaving. So we had a good one-on-one or good team meeting, make sure that they feel supported, know that they won't have a supervisor right there. I'll be spending about half a day there a week to make sure that everything is going smoothly over there. So, so far, so good. There are reports the remote work is going well. Any questions on that?
Which budget item are we on now?
Did you ask for behavioral health? Is that what you asked?
yeah.
We're on 12.
Yeah.
So, Alicia's report and the monthly expense report is in. Not had a chance to meet one-on-one with Alicia yet, but no major changes. Everything is looking pretty standard right now. And I don't think she's on. Anything additional? Okay, we talked about child protective services. I think we covered everything as far as that goes. Want me to keep going?
No,
Youth Justice. Youth Justice report. Sarah has included a little bit more detailed report. Big concern in the area is mainly just making sure Sarah is supported as much as we can support her. So that as she helps us out with the CPS unit and make sure that we still have these good, she's making some really good connections with some of these youth, and we don't want that kind of backpedal from there either. So that is where spending some time with her, making sure she feels supported, and meeting with Season is also supporting her as well. Economic support. Everything is looking very good in the reports. Just as a reminder, we're going to be getting ready for those Medicaid renewals that will now start moving into that mix. So looking at staffing, Shauna's getting her team ready to go. They're getting some good supports put in, prepping people for difficult conversations that could be happening. So staff is having some additional training. And then the other thing that we're needing to look at is in June or July, we'll need to start drug testing for those that are on food share and have a felony background. It was something that was done before COVID, will be put back into place now. It used to be that they were able to do that testing in unit. They're no longer able to do that. So we're looking at options on, is it public health? Is it going to be somewhere else within HHS that can do the testing? So just started to have those conversations. Shauna sent me the information right before she went on vacation. So we'll have to get a plan in place for that.
So you said food share, what else?
Food share, if they have food share and they've had a felony, then they have to be drug tested.
Did that help before?
I actually don't have a history of that, so. But they're putting it back in place. It could be some mandate that's out there too, that I'm just thinking of as part of the kind of the pulling back from the public health emergency. Other things have to be put back into place.
Who's going to do the drug testing then?
We're determining that right now. It'll be
And
done.
will it be at the person's personal expense?
It's done through the food share program.
They'll cover that
That
cost.
cost, those costs had been covered before,
Okay,
so they should be covered.
okay.
What happens if the individual fails?
I think they get pulled off, is my understanding. Yep, and you know, we'll probably have some people to pull themselves off. Anyway.
Well, hopefully they get help. Because obviously they need that support.
Yeah, and that's the good thing right now is we're doing so much of that work with the opioid settlement, looking at the substance misuse. So hopefully we'll be able to do some linkages to be able to get them if they fall off a food share, making sure that we have that outreach. Good point. Keep going. Okay.
On a roll.
Okay, so public health report is in here. One of the things with syphilis, and next time Julie will be ready to speak to everything. One of the things that we're seeing an increase on with the state is congenital syphilis rates. So had some conversations about this already, haven't we? And so we just want to make sure providers continue to be testing, especially women who are 28 weeks gestation and at delivery. So we'll watch for that. The other thing that we'll report out on hopefully next month is the Narcan Direct provider. We did get the grant for this. North Lakes used to be one of the providers. They no longer could do that. So we stepped into that. And Baziki is the other one that has the direct. We're getting a ton of people looking for the education and training. So it's been a very, very good outreach. So we'll report out on that a little bit more next time. And then we are combining the prevention coalitions, the LCO Prevention Coalition and Sawyer County. We're merging into one. So I shared the mission and purpose and vision for that. We did spend some time working on the spring flood that we didn't have any major issues that happened. We were really worried about Hayward Health Services potentially having to move residents out of there and into another building. And having had to do that during the winter storm, we were not looking forward to trying to move residents again. And then the final thing is we did have that 140 review. That is for us to be a level 2 health department, and we have not heard back, but the review seemed to go quite well.
No question.
We do get when they figure out how they separate like the big funds out, you do get more points for each level that you're in for doing it. There's reasons for doing it. And yes, because we're doing, and really we pretty much follow anything that is a level 3, except for I'm not master's prepared, so we couldn't go for the level 3, but we function more as a 3.0 health department, which means we're like community strategists and connecting the dots, and they clearly pointed that out while we were in our review. So
Does the school have a Narcan education? With
the Hayward School has had some education with the Narcan for some of the faculty.
and they have it.
They have some on-site.
Do you recall? Yes, well, Jess just said that they did have a portion of their staff already trained, but it wasn't close.
I know
between 20 and 30.
But they have someone they can call, and they've got the.
I wanted to ask too, if that syphilis rate is increasing, what can you narrow it down what population, the age, or?
We have not gotten The state's pretty slow on the final reports, so it's kind of.
Yeah, so
preliminary data.
all the data for 2022 is still preliminary, but the epidemiologist said it's a significant increase. And we are seeing it like 20 and 60 years old. I mean, we're seeing long rates. I mean, yeah, we're seeing.
Julie?
So the awareness is out there and more education and more prevention.
Yeah, and we've done a pretty good job. You know, our rates have gone down. We are attributing that to higher testing, but once that starts to happen, then people start to kind of back off a little bit from that. We want to make sure that we are encouraging HIV, hepatitis C, and syphilis testing, not just based on risk factors, but making sure we're following that true guidance across the board.
Yes.
So that is something that Jess and Julie will continue to work on.
Julia, the syphilis problem, is that just in Wisconsin or is that nationwide now?
You can answer. I
believe it's going up nationwide, but the rates in Wisconsin are increasing steadily. Before 2021, Sawyer County for 10 years had 0 cases. And then in 2021, we saw a significant increase, and we were actually, if you look at case rates by county, we were the top of the state for syphilis.
Yeah.
Because it was more of a problem.
Yeah.
Welcome to Hayward.
Yeah, like above Milwaukee.
Yeah.
Yeah.
But it was more of a problem up north than down in.
Well, part of it was we probably identified some pretty old cases of syphilis as well, because when we started testing, we tested a lot.
Yeah, a provider who had seen it where they were at previously started testing here and found a significant number of cases.
And
So it could also be a function of testing, right? If you don't look for it.
Yeah, and we're seeing Western Wisconsin going up now. So, but you know, they're hearing from us the higher rates to start testing. So some of that testing, you know, is there really more out there? Or is it a result of testing? But the more testing we do, the more we get people treated. So
the treatment, is that easily?
Yep, it's easy. It's easy to access. We can do treatment. It is two injections, right? I think no matter what, it's 2 injections. So,
Thank God it's treated.
The other question I had was with the Narcan. You said the Lakes Clinic, is it doing something with
North Lakes Clinic?
Lakes?
North Lakes Clinic used to have the grant for that. They no longer could get the grant.
I didn't get the grant.
And so then we stepped in to fill that void.
Now, do we have any more questions for Julia? Or
It's pretty easy too, just after those with Julie. Yeah. Transitional.
Yeah.
We've got the
Fiscal.
and we have Patty on, I believe, if you have questions.
I am here. If there's any questions?
No major changes or anything we should be concerned about, right?
Nothing yet. This is only 3 months in. So as you can actually see, we've only received 1 month of state mental health hospital on this purchase service recap that you're looking at right now. Otherwise, there's been no surprises other than you're going to see as we go on in the family services section, our purchase services are going to go up, but our salary and fringe would be down just because we're contracting for staff now. So you will see that as a difference, but it overall in the budget, it isn't going to it'll wash itself out.
Thank you.
any questions?
No.
We're done.
Anything from future agendas you want on?
Any type of rate that you'd like to see come through? Thanks for the thought for that.
Recommend motion.
Andrew, Mark, we have- We'll do these. Well, that's good. Okay, but no, what happens if there is people on Zoom?